Okay, guys, good morning. Hello. And hopefully, everyone is actually in a good mood today, as well as that of the past previous days. Okay, guys, I'm back, and I'm very sorry for the delays. It's been a busy week. Needed to be in an urgent care to ensure everything is safe with our pregnancy. And thank you for everyone who sent in their prayers, as well as that of their well wishes for me and my family, especially with our little angel coming in the next few months. So, yes, we're on track again. So, again, this is your NPEX coach, Alan Galingala. And welcome in the series that we're going to run moving forward, which would be our daily drills. So, what we're going to focus on these drills are actually NCLEX level form of questions, as well as that of practice on how you actually answer these questions. So, one thing that had been bugging me was that a lot of people are saying that preparing for NCLEX is just the same as reading and reviewing your notes. Okay. One thing that I would want to emphasize for everyone is that that exam as a whole has its own way of assessing you on how you think. So one of the fallacies, as well as that of let's just say fake news that most reviewers that are, giving as a marketing tool is that you needed to do this technique of ours, you needed to do this program of ours. One thing is really true. There's no such thing as an actual program that would cover NCLEX as a whole. There's no program out there that could literally create the actual mimic or the actual copy of the experience of taking an NCLEX. And above all, not everyone is going to see NCLEX more than once. Meaning the only time that you're going to encounter NCLEX will be the moment that you take the exam. So be very careful with that because right now there's have been strings of people that have been messaging me, previous students, new students, that says they were scammed. Okay, they were scammed. And this is essentially what my first video last week was all about, the NCLEX scam. That's why I just want to start our discussion with regards to that one. The first NCLEX scam that has been running around right now is that there will be this message that will pop up on different groups or sometimes in your Facebook ads or in your Facebook thread post. And then out of nowhere, it will be telling you stories of their this and that. And then a certain Mr. Someone or Miss Someone help them with their exams by making sure that they have the correct answers and their correct answer sheets. Very very surprising, right? To be honest, that someone would be able to hack into the NCSB actual test bank, which believe me, guys, I've been teaching this one for like 12 years now. There's no such thing as that capacity. Or there would be someone who will literally put their name with a picture, and then they will have all of their titles back to back to back to back to back. It's like, they have the entire alphabet at the end of their name. And then eventually they will be saying to you that, yeah, join our review for this specific price. And then they will just give you like a rundown of the entire nursing curriculum, but on a very limited, cramped, as well as that of, let's just say, unorganized time. So, guys, learning and preparing for exams, and for the longest time that I have been in charge when it comes to professional development as well as that of exposure of nurses, particularly to progressing their career, one thing that I have seen all these years is again, there is no such thing as a be all and all process. It depends on three important things. You, as a learner, is number one. You need to make sure that you are mentally, physically, and emotionally ready to take the examination. And no WhatsApp group, Facebook group, or even a person who would have like 15 titles to their name, or even let's just say someone who would claim that if they are teaching here in the US, that could give that preparation to you. One thing that I've always emphasized is that you need to reflect if you really would want to take this exam and you would want to progress your career moving forward. Then ask yourself, are you ready for the sacrifice, effort, as well as that of the actual time that you're needing to give in order to prepare for this? That's the second thing that you need to consider. This is an exam that requires a lot of effort, not simply because you need to study nursing from beginning to end, but essentially you would want to actually show this exam that you are thinking as the nurse that is qualified to think for this exam. That is what this exam is all about. And number three, especially in the beginning preparations for your exam, one thing that you always need to put into yourself is that you will want to pass this. Okay? No pep talk. Again, no pep talk, no instructors, no cheering squad could actually trigger you to actually have that thinking. A passing mindset would always focus on your actual endpoint, not on just what you are using. Whatever you use, whatever technique, capacities that you're going to do, it all boils down to one thing: your overall acceptance that your life is about to change. And you need to be ready for that change before it even begins. Okay? So, enough of the motivational thingy. Let's answer that 10 questions that I have prepared for you. So, I will then send another set of 10 questions after this, just to tell you guys, okay? So that we will continue on with our drills. Okay, so the first set of 10 questions, you might find it it's a little bit easy compared to the previous question banks that I have ever encountered. Yes, because I intended to do it like that. I want you guys to actually experience how is it to think through the clinical judgment model, which is the basis of evaluation for your NCLEX. It's not about knowing. Again, I want to emphasize that. It's not about knowing everything about nursing. It's about putting that knowledge into action so that NCLEX will see you as a capable nurse more than anything else. So that's how we are going to make sure that our drills is going to run. What's going to happen to set expectation is that I will create every week at least two sets of 10 questions that will have an improving or an increasing difficulty as we progress. So the first set of 10 questions are essentially at the bottom of the Bloom's taxonomy, which is focusing primarily on remembering and recalling. So have you noticed most of you have already given your answers to it, and it was so quick that you were able to finish it in a span of like what, 30 seconds? Why? Because that is the main purpose of it, to tickle your mind and start your actual view of the exam in a perspective that what the exam would also want you to do. Asking first, what do you know? Trying to test your level of remembering. And then eventually it will devolve in or rather evolve into analysis, prioritization, generation of solutions, and eventually effective evaluations and progression of care. Okay, so let me share my screen here. And hopefully you'll be able to see, okay, my second screen. So welcome to our daily drills, of course, courtesy by your everyday coach, Coach Len. Okay, so let's begin with the first question, focusing on prioritization. So again, it is indicating here that this will have, so most of the questions that you're going to encounter on the drills that we will be running will be focused primarily on the different aspect of the exam and how it's actually being given. So you will notice the structure of that, beginning with, of course, the what's the question is all about, this one, okay, and then an actual NCLEX question in the bottom. In the next few weeks, we will also throw in some case studies in order for you to be exposed to those kinds of questions. Okay. Again, because there was someone who was actually sending me a message a couple of days ago and was asking me if I'm going to charge you eventually with this, because what happened to them is that they were able to join a WhatsApp group that started on as a free thing, and then out of nowhere they are being continually asked to pay for at least, I think, $1,000. Okay, again, this is free. So for my Filipino friends there who is like asking why am I going all out English, it's because some of our students are all coming from all over the world. Okay, so we have students coming from India, the Middle East Peninsula. We also have nurses coming in Africa. So shout out to you guys who are watching this tonight or today or this morning, wherever what time, whatever time frame you are. Okay, hope that you are going to learn. So again, I'm not doing this for any profit. I'm not going to ask you to pay me whatever, whatnot. This is something that will help you. Of course, if you would want an actual full-blown program that you will be into, I have like a 2-week program that we could set up in order for you to actually start the class, and then I could give you the necessary coaching. I would recommend, if you would want to go on that route, that create a group, probably 5-4, so that there would be an interactive discussion, and then we could do a deep dive discussion of the questions. And it would be very recommended before you actually take the exam, probably a week or two, so that you'll be ready, whatever might happen in your exam. Okay, so enough of that. More likely, that's the time that I will charge essentially, if you would want to have like a very focused discussion. But nonetheless, I will fill you up with all the knowledge that you need in this group, as well as that in my page, in order for you to actually be ready. Again, not everyone has the money to pay, but everyone has, okay? Everyone has that willingness to learn. And that's what we're going to maximize on. Beginning with question number one. Okay, let's go in here now. Most of the questions of prioritization could actually look like this. For those who are first-time takers of NCLEX, one thing that you need to understand is that there could be standalone question that doesn't have any context at all. It's like a straightforward question, as you could see here. A nurse is caring for 4 clients. And then, which would the nurse assess first? Very straightforward question, no cases, no other evidence, pinpoint question. What are you going to do first? Okay, when you encounter this type of question, rest assured that you are doing good in your NCLEX. It only means that you are meeting the requirements, simply because prioritization questions are decision making questions. In the level of difficulty, it's probably around third or fourth level, depending on how the question was actually penned. So for this one, always remember NCLEX questions have 2 parts. Okay, and they include your subject as well as that of your STEM. Okay, so for this one, technically there's like no subject. Point of the subject here is that there is 4 clients, meaning you are handling multiple care. Now the STEM is essentially what the question would want you to answer, and that would be who would be to assess first. Very easy question. Most of you were able to get this almost immediately. And if I am not mistaken, a lot of you were able to answer immediately with this one with the correct answer. So what would that be? Going back to your choices, you have an asthma, reporting shortness of breath. Mhm. And then you have cellulitis, which is an infection of the soft tissues, particularly beginning at the skin, that is needing their antibiotic. And then there is also an individual who would need a discharge teaching. And finally, asking questions about their diet. So, one thing about prioritization, guys, is that you need to ensure that you understand the concept of prioritizing care. And it always goes with A, B, C, D, E. Okay, so what is that? Airway, breathing, circulation, disease conditions, and finally, education. There's an F here as well, which is the last one, and this is feelings. Essentially, that would manifest your Maslow's hierarchy of needs. So you first go with physiological needs that would require survivability before you go forward into the concept of self-actualization, which could be covered with your education as well as that of your feelings. So how do we go about it? Let's put it on your prioritization. Let's Maslow the question, as what I was saying in my previous classes before. So let's begin. An asthma client who cannot breathe. Self-explanatory. This is airway. Cellulitis that needed their IV antibiotic. This is a disease process. And then finally, look at those two. These two are essentially education. So in a concept of multiple choice, one test-taking strategy is that there will never be two answers unless that multiple choice is a SATA status, or rather select all that apply one. So what would be the best answer for this one? Of course, the correct answer here is A. 1 point, sir. Congratulations if you got it right. Okay, so we prioritize airway. Again, why? Because that's survivability. We are not going to focus primarily on your disease conditions. Why? Because the disease condition is being treated. Okay, so this is a treatment. Essentially, your patient is already stable. Okay, they're stable. So you prioritize one that would need care, while the other two are actually both of the same requirement as well as that of need, which is education needs. Okay. So use this technique, especially when you're dealing with prioritization question. Okay, let's go to question number 2, one of the most dreaded form of questions in NCLEX, pharmacology. Okay, so moving now, let's do the subject and the stem dissection of the question. So the subject here is none other than your medication, digoxin. And then one thing that the question is asking, particularly the STEM, is what would prompt you as a nurse to uphold or rather hold the medication or don't give the medication? So let's try to answer it. Now, what is digoxin? Digoxin essentially is a inotropic, okay? It's an inotropic agent. What's happened to my pen again? Sorry, guys. Mhm. So when you're talking about an inotropic agent, its main purpose is to increase your contractility or the heart's ability to increase its pumping power. So in order for your medication to do that, it needed to decrease the actual flow of your heart or the actual, what's the actual what? The actual, try to complete it in your thought. The actual rate of the heart. The faster your heart rate is, the weaker the ability of your heart to pump out blood. So you needed to make sure that you will limit that. So if that will have a negative chronotropic effect, okay, that will decrease the heart rate. What is your biggest concern for this one? So, guys, if you answer letter A, okay, if you answer letter A, that will indicate that you are what? That will indicate that you're a good nurse. Okay, so A is your correct answer. Okay, what's happened to my pen again? Okay. Hmm? Because anything that would already trigger sinus bradycardia could actually be worsened if you are going to give an inotropic agent. So, what are those other medications that could affect the heart rate? Of course, you have your beta blockers. Metoprolol is the classic one. Labetalol is another one. Another one that could affect it will be your calcium channel blockers, particularly amlodipine. So be very mindful of those ones when you are giving it, especially if there is sinus bradycardia or any heart rate that is lower than 60. So we're progressing well. Did anyone got it right already for two? Mhm. So hopefully you'll be able to get it correctly. Let's go to the next question. The next question is your Clostridium difficile or your C. diff. Point of the matter is simple. What would be the best way for us to protect ourselves when you're talking about C. diff? So C. diff is a very resistant gastrointestinal infection of the lower GI tract, primarily your colon. Very common nosocomial infection. That is why it is imperative that you will use protective personal equipment. So, with that at hand, what would be the actual, okay, personal protective equipment that you're going to use for your Clostridium difficile? So, golden rule of the thumb, if that is anything that is focused primarily for secretions or any other form of excrement, as well as that of urine, stool, vomit, it could be a it could be a what? A contact precaution. So when you're dealing with contact precaution, the most required PPE would essentially be your your what? Your gloves, and your gown. Okay. Why don't we need the many mask? Okay. The only thing that you're going to use mask for this one is that if you cannot actually, because the smell, it's a very pungent odor, primarily when it comes to the stool for people with this one. So if you got it with your B, okay, your gloves and gown, great job. Okay. So another one, especially for those working on the US side, particularly those that are working on your skilled nursing facilities or long-term acute care, be very mindful if there would be a sudden, okay, outbreak of diarrhea. Especially for some individuals, norovirus is around the corner, especially during the fall season. So be very mindful of that because you could mistaken norovirus into Clostridium difficile. There could be a possibility that the patient would already be C. diff. So one thing that I would highly recommend, especially for LPNs as well as the CNAs that we have here preparing for their NCLEX, eventually for being an RN, make sure that you run your stool test just to make sure, okay? Just to make sure that you don't have any form of C. diff because this will immediately spread. This is a highly contagious condition. Okay, now let's go to the next one on our list. Okay, next one on our list is an infection control again, but oh, sorry, this is not infection control. This is mental health. Okay, this is still mental health. Now we're focusing on the concept of your Alzheimer's, which is having sundowning. Okay, so for most of us or for most students coming from the Philippines, you might not have an idea of this one, or this could be a foreign concept simply because we don't have any Alzheimer's home there. Nonetheless, when you're talking about sundowning, this is the moment when the confusion of a person who has Alzheimer's suddenly peaked. Usually, this happens at night, hence the name sundowning, simply because there would be a total disorientation of the time, place, as well as that of the situation where they're in. And this would aggravate all of the confusion attacks that the person is currently seeing. Now, the question is, they becomes agitated at night. So if they are agitated at night, what would be your best nursing intervention? Common thing about uh, sorry, common thing about your mental health is that when you're talking about restricting clients or patients or restraining patients, it is always on the least, okay, restrictive, all the way going down to the most restrictive. So what are your least restrictive means? Therapeutic communication, diversion, reorientation, as well as that of mindfulness techniques that you could use for your patients. Most restrictive, restraints, both chemical and physical. Chemical in the form of medication. In most cases, we are using lorazepam, diazepam. We're also using clonazepam. And then sometimes phenobarbital could also be thrown in into the mix. Physical restraints, of course, will be our classic tie-ups. So you have either a two-point restraints, focusing primarily on the arms, usually that's where we actually place it. And then you also have one on the leg, or a 4-point one wherein every extremities is being tied up. There is also a sort of a jacket or a vest restraint. Essentially, that would be the one that would be affixed to the bed. And in some cases, there are also mittens for very minimal but restrictive means, just to prevent them from pulling every form of tubes they have in their body. Now, it is not saying that this is an inpatient person that has all of those needed tubes. This is an Alzheimer's patient, meaning this is a person that could be independent, could be walking around, could be able to do his stuff. The only thing that limits him when it comes to quality of living is that he has Alzheimer's that would eventually trigger severe confusion and disorientation because of the memory loss. Now, what would be the best answer that we would do? Again, the best nursing intervention would always be the least restrictive, nothing more, nothing less. So, will it be administered sedatives? No, because this is essentially your most restrictive points. Place the client in physical restraints, same thing. Rule of the thumb, there are no two correct answers, so automatically eliminate it. One thing about multiple choice is that you need to eliminate as many items as you could when it comes to the choices. That will be able to put you to a 50-50% chance to get the answer correct. Now, you have the distraction, which is good, versus that of bed alarm and doing frequent checks. So what do you think would be the best answer for this? Okay. So if you answered C, which is using your bed alarm, it triggered an option. You answered it correctly. Okay. So we maintain safety by making sure that we know if the client is moving or not. Question 5, moving forward, we have a maternal rather, and newborn question, focusing on a newborn who is born to a mother with gestational diabetes. And we all know when you have gestational diabetes, there's a possibility that the patient or the mom would essentially have what? Insulin. Okay. And then at the same time, what else is happening? What else is happening? Sometimes, okay, the baby's sugar, in a sense, is actually being used by the mom simply because there is no enough sugar primarily on her cells. But most common things is that the treatment for your gestational diabetes does include insulin. So if there is insulin that is being given, especially for the mom, you could immediately consider there is hypoglycemia. So what would be the sign and symptom of hypoglycemia that you will see in a newborn? That is essentially what the question is all about. Again, the subject, and that is your STEM. So let's have it. A, jitteriness. B, weight of 9 pounds and 5 ounces. Respiratory rate of 52 per minute. And acrocyanosis. Correct answer? If you answered A, very good. Okay. This is also a manifestation for adults in the form of restlessness, wherein the patient will have some shortness of breath, inability to concentrate. There will be clammy, cold extremities, as well as sometimes tremors. Jitteriness is the one that you will see primarily with the baby, where the baby looks like very irritable and is having a weak cry. That is an indication of hypoglycemia, as well as that of a decrease in the overall activity. So always keep in mind, guys, this is not just about the mom. When you're dealing with a mom and baby question, always take into consideration the safety of the baby first. Keep that in mind, especially with this kind of setup, if ever you encounter this on your NCLEX question. Question number 6, mental health. The client with schizophrenia, this is your subject, indicates that the government has implanted a chip on my brain. Okay, so what does this tell to you? This is an example of your delusion. Okay, and your delusion is essentially in what theme? Okay, always remember when you're dealing with delusions and hallucinations, you need to understand the theme. It's because sometimes it's the theme that would create the danger for the patient. So let's say, for example, it could be a delusion of jealousy. Mhm. Sometimes a person could be so jealous, especially if there would be the presence of mental illnesses, that they could do what? They could do stalking. At some point, they could even kill people. Delusion of grandeur, very common for narcissist people, believes that they are what? The incarnation of God. They're like the best of the best out there. And then you have also your delusion of the one that you're seeing here. This is an example of your delusion of persecution. Okay, so this is your delusion of persecution. Why is not there we go. Okay. So the patient thinks that there is someone endangering him continually. So what would be the appropriate response on this one? Okay, appropriate response. If you answered B, that is your correct answer. The most therapeutic thing in order to counter delusions, because they are not anchored in reality, bring them back to their reality. Okay, one thing that I always tell my students, especially in the undergrad and the postgrad before, when I was given the opportunity to teach back in the Philippines, focusing on mental health, never, never feed on any form of delusion and hallucination. Okay, because that will just worsen the condition altogether. Okay, so never ask, why do you think that? Okay, you're giving the person justification. Okay, or do not argue and discount the patient's feelings and thoughts, because remember, you're dealing with schizophrenia. You don't have any idea what they have up there. Okay, question number 7 is pediatric nursing. You are assessing a 12-month-old child, and which finding would be or should be reported to your provider? Essentially, it's asking you which is showing a danger for the patient. Okay, so 12 months old, based on the required expected development levels as well as milestones, this should already have, or the kid should already have what? Global control of his, okay, of his what? Of his general motor skills, probably walking, standing. Okay, another one is he's also mastering the fine motor skills. So he could now grip, and the grip could now have function. The thing, though, that's most concerning here is essentially what? hmm I've already indicated it. Okay, so he already pulls up a standing position, controlled. Yes, so that's not the okay correct answer. Remember, this is a negative format question, meaning it is a question that would want you to see what is wrong. So anything that is normal is not included. Okay, a lot of people indicated A. It's not A. Okay, the correct answer here is C. Hmm? Any form of speech delay after the 8th month is already a challenge. So you need to check if the child would have hearing difficulties, as well as that if there would be a global developmental delay. That is the reason why it is very imperative for every parents, and I would like to advocate for this, especially if there's like an upcoming mom or dad in the class that will be listening to this. Make sure that you have your genetic testing, just to make sure that the baby is not going to be exposed to any form of global developmental delays. Okay, that's your number 7. So anything that is normal is wrong, because this is again a negative format question. Okay, the next question, also a common question in NCLEX, your delegation question. So we are now talking about the unlicensed assistive personnel. So you could call them with a lot. Okay, they could be the nursing assistants, the nurse tech, the ambulatory tech, the hygienic tech here in the US, as well as in the Australian delivery. That's how you call them. Now, the thing is, when you're talking about an unlicensed assistive personnel, they could only do ADL task. Okay, anything that will not include any nursing. Okay, no nursing task. Okay, so what could be those nursing tasks? ADPI, assessment, diagnosing, planning, intervening or interventions, and evaluation. So teaching a client how to use a walker, nursing task, nursing skill. Yes, so that is incorrect. Administering a fleet enema treatment, also eliminated. Now, just look at what I told. They could do ADLs. So, what are ADLs? Ambulation, hygiene, grooming, feeding, except for NGT as well as peg tube feeding. Okay? General companionship. So, the correct answer is letter C. Okay. So always remember, any form of unlicensed personnel would always focus primarily on assistance of ADLs. Okay? So any form of teaching, treatment, interventions, medication administration is off limits. Question number 9 for medical surgical nursing. You have a patient whose chest tube becomes short of breath. So a patient who has a chest tube suddenly indicated SOB. The nurse notes the drainage chamber is cracked and leaking. Okay, that's the reason why if you will have things like this, make sure that you are, okay, that you are essentially checking the equipment as well. Okay, so be very mindful of that one. Now, moving forward, what would be the best answer for this one? What would be the first thing that you needed to do? Mhm. You needed to prevent, if you were able to watch one of my respiratory classes, the problem with the chest tube is that it's removing any form of excessive air on the affected lung. So what are we going to do? We're going to prevent it from leaking. And the only way that for you to stop it from leaking is to, are you going to clamp? No, you do not clamp it because that will build up pressure inside. So the best way to actually allow it to remove this excessive pressure from that positive pressure air is to put it under a, okay, sterile water. Okay, so the end of it will be placed on a sterile water in order for it to relieve the air but not totally clog it. Okay, so that's the one that you're going to focus on. Finally, question number 10. Oh, the last question is focused on our nutrition. This is not medical surgical. Sorry, guys. Also, a common place on the NCLEX. Okay, NCLEX discussions. So in nutrition, what food should the nurse teach a client with chronic kidney disease to avoid? So you're talking about chronic kidney disease. Okay, what's the main thing that we needed to help it prevent with this one? It is essentially potassium. Okay, so low potassium diet. So what would be the best thing to give the, or rather, which of the following should the patient avoid? Which the client would receive the thing that the patient would avoid? You will avoid bananas. Okay, because bananas is high in your potassium. So we're able to get 10 points. Okay. So anyone who are able to get 10 points, give yourself a good clap and tap on the back. Nice job in doing what you need to do. And we're able to hopefully get tips on how to answer basic questions. Okay. So hopefully I was able to help you on that one. Now, before anything else and before we end this very good learning discussion, one thing that I would always leave to you guys is always try to reach the best you. Never stop trying, never stop practicing. Okay? Never get someone's information or views and opinions of how you do and how are you going to reach your goals. Always focus on what you wanted to actually reach. So your friendly neighborhood coach will always be here, and I'll be happy to once again give you more tips. So watch out for my videos, particularly on my personal page. I will have more videos there, inspirational as well as that of informational in nature, some tips as well as that of some stuff that would help you focus primarily on things that you would want to do. And finally, one thing that I would want to emphasize as well is that failure or not, success or whatnot, at the end of the day, you build your best you. Thank you guys, and see you again on our next learning session.